this morning is just review the respiratory anatomy models with you because...
They're all videotaping.
Thank you.
Sure.
So that we can help you guys study for tomorrow's exam. And then tomorrow we'll do the review for the other organ systems as well. Okay? All right, we're going to do respiratory first. So air is going to enter into the nasal cavity. Nasal cavity is going to warm and humidify the air, right? Okay, what are the ridges called? Those are the nasal concha, right? And the spaces in between, the meatuses, right? Okay, so the air we breathe is going to be warmed and humidified as it passes through the cavity. Okay, you have sinuses, okay, that basically will communicate with the nasal cavity. You've got the frontal sinus, the sphenoid, the ethmoid sinus, and the sphenoid sinus. Okay, the little slash there is the opening to the auditory canal, and that's the break point between the nasal cavity and the pharynx. Okay, within the pharynx we have the first of the air filters, right, our lymph nodules, if you will. Okay, this guy is called what? Pharyngeal tonsils, right? When they get inflamed or infected, you call them the adenoids. Okay? This tonsil in the oral cavity is palatine tonsil, and at the tip of the tongue, or the base of the tongue there, that's the lingual tonsil. If you're breathing, the air is going to get directed into the larynx, right? Okay? So we have nasal cavity, then we have nasopharynx, oropharynx, laryngopharynx. If you've got food in the oral cavity and you don't want to aspirate it up into the nasal cavity, what do you use? The uvula, and this is the uvula right here. This is the hard palate and the soft palate, and the tip is the uvula, okay? If you're swallowing food, you don't want it to get into the lower respiratory tract. What do you close? Epiglottis, and this is the epiglottis, okay? The opening into the larynx is called the glottis, okay? And the slit here is the vocal folds, and you produce sound during inhaling or exhaling? Exhaling, yes. Okay, big pharynx.
You talking about?
Yeah, that's good. Okay, so on this guy, folks, you put a sticker here. That's going to be, that's a thyroid cartilage. The one right here is the cricoid cartilage, and this is the trachea, okay, supported by cartilage rings so it stays open, okay, and the little flap, that's supposed to be your epiglottis, okay. This guy shows the same thing, thyroid cartilage, cricoid cartilage, trachea with the cartilage rings. The muscle tube back here is the beginning of the esophagus, okay. When we open it up, we've got epiglottis, vocal folds, and the space again is the glottis. Okay. Slab lung, or, yeah, guess what? Without us, I don't want to hit anybody. Okay. All right, got it. Okay, guys. This would be your trachea, right? Okay? It's split. First split. Primary bronchus going to the right and the left lung, to the lobes of the lung. Secondary bronchus to the lobules of the lung. Tertiary bronchus. And when we lose the cartilage support, then we're in the bronchioles. Okay? And remember, guys, that when we look at the alveoli under the microscope, it is what? What type of tissue? Simple squamous epithelium. So where's the that blue guy with the different color? No. There, that. And then the diaphragm model should be enough. Okay, so this is the trachea, right? Primary, secondary, and the colored guys are the tertiary, okay? Remember, the cartilage rings don't go all the way around the trachea, right? So when that bolus of food comes down, it pooches into the trachea, so you can't breathe, and eat at the same time, okay? All right. Yeah, so I'm not exactly sure how we're going to do this on the practical. But if it's dome-shaped, guys, is this relaxed or contracted? It's relaxed, and at this point you are doing what? Exhaling or inhaling? Exhaling. When you contract, okay, then it's flat, right? Okay, and you're inhaling. Okay, what happens to the pressure in the chamber? Pressure decreases, volume increases when you inhale. When you exhale, pressure increases, volume decreases, right? Okay? Just remember that's inverse. Okay? Pressure and volume. Anything else? Okay. For the other thing we need to do is on that torso, the muscles